the patient sensitively, because a lot of patients that you get will have some form of dental anxiety. They will be scared to come to the dentist. So you need to be sensitive and empathetic. And you also need to use clear and unambiguous language. So you don't want to use complex terms, which is known as jargon. You want to simplify terms so the patient can actually understand. And it's really important to listen to your patients. You want to get to know them and you want to build a rapport. So good listening skills are really important. Also, body language to show that you are listening. So like active listening, so nodding your head, also asking them questions, maybe repeating what they say to you. So in an interview, if they ask you about communication skills, it's really important to link it back to what you've seen at your work experience, and also link it back to yourself. So how was your volunteering or extracurricular activities that you've done? How has that helped you build your communication skills? For example, you could say that when you did your work experience, the dentist explained procedures step by step, or they use analogies instead of using the complex terms. For example, I did volunteering at an after school centre, so you could talk about how you had to adapt your language in the way you talk when you're talking with children. And then maybe if you volunteered in a care home, you could talk about how you also had to adapt the way you communicated when talking to older patients. So always link it back to what you saw at your work experience and link it back to yourself and show how you have good communication skills.
So another really important skill is manual dexterity, and this is the ability to use your hands and your fingers with precision. Of course, it's really important for dentists because when you're doing any dental procedure, you're working within a really small space. You need to be precise. You're kind of doing finer details, especially with aesthetic dentistry, but anything really. And you need good hand-eye coordination. So there are different ways that you can demonstrate this skill, and we put a few down, such as crocheting, knitting, drawing, painting, playing an instrument, carving, sewing. You can get really creative with this, and it's a good way to show off your personality to the interviewer. And it's a nice thing to do because it shows that you're kind of a well-rounded person with creative outlets. And if your interview is online, which is quite likely, then you can always hold something up to the screen on the call to show them, or play an instrument for a few seconds. Have something prepared.
So now we'll move on to the 9 GDC principles. So firstly, does anyone know what GDC stands for?
Yeah,
that's right. Well done. Yes, so it's General Dental Council, and it's a regulatory board for dentists in the UK and other members of the MDT. So they set out principles that ensure patients' safety and patients' interests. So the 9 principles, as you can see on the slide, they're put patients' interests first, communicate effectively with patients, obtain valid consent, maintain and protect patients' information, have a clear and effective complaints procedure, work with colleagues in a way that's in patients' best interests, maintain, develop and work within our professional knowledge and skills, raise concerns if patients are at risk, and make sure our personal behaviour maintains confidence in us and in the dental profession. So these are actually, they may seem like separate points, but they're actually really interlinked. Because, for example, to obtain valid consent, you need to be able to communicate effectively with the patient. Because if you're doing a procedure like a root canal treatment, which the patient may not know what it is already, you'd have to explain it to them step by step, and then only the consent will be valid. And then having a clear and effective complaints procedure is also part of good communication, because it means you're taking the patient's feedback and acting on it. And of course, to ensure patients' best interests, you need to communicate well with the nurse, with the other members, with the whole team. So it's good to know about these principles because you can use them in your interview answers. So for example, if you're given a situation in which the nurse and the dentist are not communicating well, then you can be like, well, that's not good, because the second principle is to communicate effectively or to work with colleagues in a way that's in patients' best interests. So yeah, just make sure you're able to use these in your interview answers, and that's a really good thing to do.
Okay, so next I'll be talking about medical ethics. So it's really important to have an understanding of this, because it will help you when you get questions about ethical dilemmas, or they may give you a scenario and ask how you would respond, or maybe even a role play. So it's just good to have a general idea of this. So there are 4 pillars of medical ethics. Does anyone know what these are? Yeah. Yeah. The fourth one.
One next.
So you guys have said justice, non-maleficence, autonomy.
Yeah.
Yeah. Okay. So autonomy is defined as the right of competent adults to make informed decisions about their treatment, and that's also you as a dentist respecting their right to make these decisions, to choose freely and not really trying to influence their decision. Beneficence is the duty to do good for patients and act in their best interest. And if you remember from the previous slide, this is linked really closely to the first GDC principle, which is about putting the patient's interest first. Then there's non-maleficence, which is the duty to do no harm to patients. And this is also linked to the GDC principles. And then justice is ensuring that all patients receive the same quality of care, the same access to treatment, and that all actions taken are legal. So I think when you remember the pillars, also try to remember the GDC principles so that you can make it more relevant to dentistry. And then these are some extra things that you can look into in regards to ethics. So capacity to consent. I think when you're doing your research, try and make sure that you can answer these 3 questions. So how do you determine whether someone has capacity to consent? So capacity means the ability to use and understand information to make a decision, and then the ability to communicate that decision. So things that you can check to ensure that that person has capacity is, can they understand the information? Can they remember that information? Can they use that information to make a decision? And can they actually communicate that decision to you? So this could be by speaking, or for example, someone that is nonverbal, this could be by sign language. It's also important to remember that capacity can change, it varies. So for example, somebody that's intoxicated, they may not have capacity at that particular time, but if they were to come in for another appointment, they would have capacity. And some things that could mean a person doesn't have capacity are things that impair or disturb their mind. So if a person has a mental health condition, for example, schizophrenia or bipolar, if they have a severe learning disability, if they have dementia, so you can just look into some of these things. And then Gillett competence, you can try and do research so you can answer this question. Can children under the age of 16 consent to medical or dental treatment? So normally a child under 16 would have to, their parent or their carer would give consent. But if a child is deemed to be intelligent enough, if they understand enough about the treatment, they may come under this category of Gillett competence. So they may be able to consent to the treatment by themselves. And then you can also look into the case of Montgomery versus Lancashire, which happened in 2015. This was a landmark case that really shifted things in medical ethics. So you can look into that as well. But basically there was a pregnant woman, she was quite small frame, she had diabetes, she gave birth the natural way, and there were some complications in the pregnancy and her child ended up having cerebral palsy. So she sued, and she actually, the court voted in favor of her because the doctor hadn't told her all the information that she wanted to know. So the doctor said the information that he thought was relevant, but now you have to tell patients all information they want to know. So even if you think it's insignificant or it's not important, if it's really not likely to happen at all, if it's something the patient is concerned about, you do have to tell them. And this is known as material risk. So you can look into that as well.
So why dentistry? This is one of the most common questions you'll be asked in your interviews. Usually a good way to structure your answer is to give 3 points. And so now what we're going to do is give you some examples of answers. So I want to help society. I want to work with people. My uncle's a dentist and it pays well. So what do you think of these answers? Like, you can type your answer in the chat or like just volunteer. Yeah.
Any thoughts?
Yeah.
Oh, sorry, what was that? Fake. Vague. Yeah, yeah, I agree with that.
Yeah.
When we said like what and show like your passion. Following someone's footsteps.
Yeah, that's really true.
Very generic, like many areas in society, particularly working with people or helping people. So why dentistry and not something else?
Yeah, that's a really good point. Yeah, it's basically the answers. Yeah, as you said, they are really vague. They're not very specific, and they don't show your personal like interest in dentistry. Yeah, so you just don't want that. Okay. Now some more answers. I love the way that dentists are able to build a rapport with their patients. I realize the massive impact dentists can have on the self-esteem of their patients. I really like the hands-on practical aspect of dentistry, and no 2 days are ever the same. So why are these answers better? Yeah.
It's specific to dentistry, so like, as you said, they're not very generic. They're telling you like why they have a passion for dentistry as a profession.
Yeah, exactly. Anyone else?
Don't be any messages in the chat.
Yeah, so yeah, you basically got that right. These are they're more personal, and they really show that you've done some thinking, because in order to come to these kind of like, in order to say these kind of things, you need to have reflected on things like work experience. So personally, I realized the massive impact that dentists can have on the self-esteem of their patients during work experience, because I saw a woman who was very self-conscious of the gap in her teeth, and she wanted to like avoid going to her nephew's wedding because of it. But then after receiving a denture, she was so like impacted, like she started tearing up, and she was like, oh, you know, it's like it impacted her so much. And then she decided to go to the wedding because she was so much more confident. And that really like touched me. And yeah, I just thought that, wow, dentists can really impact the lives of people so much, like more than you would think. And of course, dentists are able to build a rapport with their patients, because as a family dentist, they see the patients repeatedly like over the years, and building that relationship is something that I would look forward to doing. So that's personally what I thought. But like during work experience, you can, whatever stands out to you is something that's really good to talk about. And of course, like dentistry is a very hands-on practical career. I know today is ever the same because you'll see different patients every day, different scenarios, different every day. So of course, these answers are what you want.
So why Barts? This is a question that if you have a Barts interview, you're definitely going to get. So we've got some things that you can say. So for example, early patient contact in second year. So obviously with COVID, things are a bit different, but normally you would get patients at the end of second year, which is really good, early patient contact. Obviously we have the phantom heads, but it's really nice to be able to have your own patients and really be able to practice in person. So this is a great thing about Barts. You get to do an elective at the end of fourth year. There's an opportunity for you to intercalate, so you can do a different course for a year. The hospital was newly built in 2014, so it's really modern, and they have state-of-the-art facilities. We also have outreach clinics in Stratford and Canary Wharf. These are really great. They're around the area as well, so it's easy to travel to them. And then there's a diverse population, so you get to see a range of conditions that you may not see in other areas. So by the time it comes to you being a real dentist and actually practicing, you would have kind of experienced a lot compared to people that go to other universities. Also with that, it would be good to find out what the population of Tower Hamlets is. So there's a large Bengali population, so find out a few facts like that. And then also it's a relatively small dental school. So if you come to the open day, or even when you come, you'll find out that there's a really strong sense of community, especially within the dental school. Everyone's really close, everyone's really helpful. The older years help the younger years. So it is a really great environment to learn.
Just one thing to add to that slide, anyone who does have a Barts interview here or people online, it's worth remembering the Gutman and Barkentine clinic names, because last year I was helping out with interviews and they actually expected people to know what they were. So it's worth making sure you have a thorough read through Barts's like website, prospectus, just so that you know a good amount about how the course works and what we have access to.
Yeah. And with the outreach clinic, so a lot of the time, first year, second year, you're based here in Whitechapel, but outreach clinics, so for this year I started, you go to Stratford or you go to Canary Wharf and you actually get your own patients. So you'll either be assisting, which is when you're doing the role of dental nurse, or you will be the actual dentist treating them. So yeah, that's a really great opportunity as well.
So now we'll go into the STAR method, which is a great way of structuring interview answers, questions that ask you to describe a time you had to do something. So a time you had to show empathy or lead a team or demonstrate resilience, for example. This method just structures your answers. So
as Padma runs through the STAR method, I'm going to be answering the question, give an example of a time you showed empathy, just kind of following the structure to give you an idea of how you can use it.
So firstly, you would talk about the situation and set the scene. So what was it? Where was it? When was it?
So a friend recently confided in me about difficulties they were having with their mental health and their studies. They said that they'd been keeping things bottled in for a long time and they decided to open up to me about how they were feeling.
Then the task, explain the task and the role involved.
So I wanted to make sure that they felt listened to, reassured, and hopefully a little bit lighter by the end of the conversation.
So action, what you did.
So I listened to everything they had to say, empathized with them, told them that I was there for them, and suggested that they speak to the university student support team. I then made an effort to check up on them from time to time and just see how they were doing with uni and in their own selves.
And the results, so what the outcome was.
They gained the courage from our conversation to contact student support about the things that had been troubling them, and they went on to have counselling as a result, which they found beneficial.
And then lastly, reflection, so what you did well and what you think could have been better.
So I listened carefully to my friend without interrupting them. I heard everything that they had to say, they got everything off their chest, and I was empathetic and supportive. I signposted them to the relevant services to make sure that they got help from trained staff members. So it's good to have a friend check in with you, but when someone is struggling a bit more, then it's important to kind of signpost them.
So yeah, this, as I said, it's how to structure your answers, but I think the most important part is reflection, because it shows the examiner that you've taken some time to think about the situation and you know like what to do for next time to make it better. So make sure you like talk about that. So now we've got some more questions that you may be asked. So what are the challenges of being a dentist? So in this one, they just want to see that you don't have like all like, you know, all good, all rosy view of it, and you actually have a full-rounded view of how it is to be a dentist, including the challenges. So does anyone have any ideas of what the challenges could be?
Mm-hmm.
Yeah. Yeah, that's good. Yeah.
I think our expectations of patients, because I feel like dentistry is like a 50-50 partnership. There's only so much you can do. The patient needs to maintain the whole work on their end. So the patient can like, oh, you said this procedure would help me, but they didn't maintain their own oral health. They can come back and blame you, but actually it's not their fault necessarily because it works for the kids.
Yeah, that's a really good point.
Being able to manage back of patients or our experience that my dentist told me that it's important to know when to say no, because he would have to take time during his lunch working hours, which places a lot of stress on him.
Yeah, these are all really good points.
Yeah. There's some on the chat as well. So people are saying finding a work-life balance, the financial challenges, I'm not sure about that, but dental line. Sorry.
If people doing privately or don't have their own practice. And
Yeah, that's true. And also dental anxiety. So you know, a lot of dental patients are very scared of the dentist, and that can be a bit difficult to deal with and a bit disheartening as well, because you end up being, you know, passionate about your day job, but then perhaps a lot of people coming in aren't really pleased to be there. So that's another thing to deal with. But,
yeah, I think for that, then you just have to kind of use your empathy and communication to kind of like calm them down and just build up like trust. So as you said, stress, it can be very stressful because of time constraints. You only have a certain amount of like minutes before each appointment, and then if the appointment overruns, then that can be quite stressful, because obviously you have patients who are waiting and they may become like aggressive. They may be like, well, you know, I've been waiting out here for 20 minutes. And then sometimes even lab work. Like, for example, if you send a crown to be made, or you want a denture to be made from the lab, and then there's a delay, that can also make the patients angry. And so yeah, like you have to deal with these kinds of things, which can cause a lot of stress. But then, as I said, it's about just kind of managing the situation, using your communication and empathy. And also it's important to not over-promise the patient anything. So if you say things like, yeah, the denture's been delayed, but you know, you will have it done in the next few days, like you can't really guarantee that. So it's important to just make sure you don't do that kind of thing as well. And then back and neck pain, as you mentioned, that's also true, because you have to sit in a certain posture for the whole day. So that can, like, just make sure to maintain good posture and then do exercise to manage that.
So one thing to add, if you get asked this question in an interview, it's good to run through those challenges, but as Padma's mentioned, you have to present solutions to the problems so that you're not just kind of putting a negative out there and going, oh yeah, there's nothing we can do about that. That's just part of the job. There are ways around these things, and you have to show that you're thinking optimistically and, you know, ways around managing them.
Yeah, and for example, if you talk about stress being an issue, you could talk about how you handle stress well, give examples, and they may even ask you this question and then kind of ask, why do you still want to be a dentist? So make sure that you can actually answer that. Like Zaina said, don't make everything seem really negative, like show how you can overcome these things.
So the next one is, why not medicine or nursing, or insert anything here really? Any ideas? Yeah.
In dentistry, patients come in even if they're completely healthy and fine. So you build the patient-dentist relationship. You can start that from an early age so that they have a good relationship with dentistry and it will be more difficult to develop exercise later on.
Absolutely. So I was just checking the chat. That's really good. Any? Yeah.
The fact that in dentistry there's a better work-life balance, rather than like if you're a doctor, you have to be in there for long shifts, night shifts sometimes. But if you're working in like a sort of general dental practice, it's sort of a 9 to 5 job.
Absolutely. Okay. So I'll just bring up what we have. Oh, it's on here. So dentistry is. Oh, sorry, I'm just going to read what's in the chat. So someone said they like the practical side of dentistry, and someone said flexibility, you can have more of a family life, which I agree with. So yeah, dentistry has more of a hands-on aspect. You know, you get to build a rapport with your patients and see them every 6 months to a year if they attend regularly. But you also get to do their treatment, which is quite unique, I would say, because in medicine, you kind of have to pick between being a surgeon and only, you know, barely interacting with patients, only doing surgical work, or being a medic and then not getting to really do any of the hands-on stuff, but having that kind of patient-doctor relationship. So dentistry is quite unique in that sense. Immediate results, it's quite rewarding to be able to treat a patient who's in pain, and then, you know, straight after the procedure, they'll be like, oh, thank you so much, you've really helped with this. Or even when they receive a denture and they have it, they put it in. So I was on clinics the other day assisting a postgraduate student, and they gave their patient a denture which had been in the works for weeks. And she was over the moon to have a full smile again. So that's a really nice thing to see. And also another thing to add is that dentistry has a unique artistic side to it, especially if you do things like aesthetic dentistry, then that can be quite fun. So yeah, interesting.
So what do you think you can bring to this university? So this, of course, will vary from university to university, but generally good things to talk about are joining societies, getting involved in volunteering, and involved with research projects. So you can go on the university website or the student union website of the university, and then you should find like a whole range of societies there, like there'll be sports societies, volunteering societies, just other things like debating or dance and anything you're interested in. So you can be like, well, if you already do something at school, maybe then you can say that you want to continue doing that at university, or you can even like found your own societies as well. So many things you can do at Barts. We have like so many, like as I said, sports societies, volunteering societies. SAMDA is a volunteering society, of course. If you come here, make sure to look into that. We help like medical and students get to university, and there's Women in Healthcare Society as well. We also have Teddy Bear Hospital, which takes medical and dental students going to primary schools to teach the children about the importance of maintaining good oral hygiene, and also for like medicine, they do things like that as well. So yeah, there's so many things you can do. So just have a research about the university so you have something to talk about.
One thing to add there, it's nice to drop names of a few different societies. Try and drop in one that's not so academic related, just to, again, show that you're a well-rounded person and you have other interests outside of studies, because the interviewers will remember you for your unique traits. You want to differentiate yourself from other people. If you go in there and you say, oh, I want to join QM photography society or something like that, then they'll be like, oh, well, this person does photography, it's something different to everything else that they're hearing. So that's one tip. And also you have access to not only the Barts societies, but all of the Mile End ones. So there's a ton. Make sure you look, if it's for Barts, that is, make sure you look at both the BLSA and QMSU websites.
So another type of question that they could ask is, give me an example of a time you've led a team. So does anyone want to have a go at answering that? You can type in the chat as well, people on Zoom. Anyone? Okay.
I was like basketball.
Yeah. Runs in the family. Runs in the family basketball. Someone else is doing it. Yeah.
Okay, so for this question, obviously in a few slides before we went through the STAR method, so you can use this to answer the question. You want to pick an example where you demonstrated really good leadership skills. You want there to be a clear structure to the answer, so you can use the STAR method. You can also use other methods, but I think that one's quite an easy one. And you want to link this back to the role of a dentist. So you can talk about why teamwork is important as a dentist and how this experience will make you a good dentist as well. So for all the questions, always link back to the qualities a dentist should have, what you saw in your work experience, or what you actually do.
Someone's asked, what if you haven't led a team?
I mean, it could literally just be like something like if you're doing a project at school, or even if you're doing a group presentation at school, just what you did
Anything really,
yeah, even if you did something like, I don't know, like organize a chat through to communicate, and then just help other people, or just, I don't know, just something like that. It could be as simple as that.
Yeah. Examples of taking initiative, but I'll be honest, you can spin things a certain way. They're not going to know if you're not telling 100% the truth, as long as you sound convincing.
Yeah.
I don't want to encourage that too much, but for example, I in a group ran a society during sixth form. I just said that I led the group. Like it's not that far away from the truth. So yeah, if you're really struggling for examples, then that's kind of a last resort. But yeah. So we're going to take a break from the questions and open up the floor to you guys for a role play. It might sound scary, but it's really not. It's not a big deal. It will only take a couple of minutes, and we'll give you a bit of feedback. And let's just show them some. So it's about breaking bad news. Can anyone tell me why breaking bad news is an important skill to have as a dentist? Yeah. Exactly. You're treating patients with diseases and infections and all sorts of things, and you have to, diagnose a patient with things like oral cancer, gum disease, or even something like telling them that they have to have a tooth taken out, or that their denture broke in the lab and needs redoing and it's going to take more appointments. You have to break bad news on a daily basis, so it's a really important skill to have. And in a panel interview, you probably wouldn't be asked to do a role play. You might, to be fair, depending on the university, but it's definitely a very common MMI station, and we've all had it before, I'm sure. So would anyone like to give it a shot? It's a good opportunity. I'm guessing it's
We can do it in pairs as well. Like
Yeah.
you can be 2 people
yeah.
to play the role of the person who lost the cat, and then I think Zaina will be the owner. Yeah.
It's a good chance to practice. If you're doing MMI, you definitely will have a role play. And even, for example, in first year dentistry, we have to do role plays as well. So it's just a good chance.
Yeah,
And here there's
no,
no
awesome.
and there's no particular like right answer here. It's just how you approach the situation. So yeah, you can do it in pairs. You can have 2
Do you think
people.
pairs? No? Anyone?
Yeah, you too?
Yeah. Okay.
Yeah, come
That's
down.
great,
Come down.
Yeah.
We have mics.
Yeah, come down.
Yeah, come down.
Thank you.
You've said it now, it's too late, come on.
Thank you, guys.
Thanks for volunteering, guys. I think I want to share and take the others. Or I can just speak from there. I don't know, they can share. Shall we all just stand? I'm just thinking about, sorry, we're just trying to work out there's a camera.
I think just
Over here.
Yeah? Oh, yeah,
Okay.
it's around.
Yeah, let's do it here. Okay.
So you're going to be
I'm gonna be the.
Do you?
Okay, so
should put trigger warning. Should put trigger warning.
so
That's
she's
not
going to
bad.
be the friend that's lost the cat, and then you guys can work together to figure out how.
Wait, no, sorry.
No,
other way around.
they're the
Other
friends.
Yeah, yeah,
Okay.
sorry. You guys are gonna be the friend who lost the cat. Is this right? It was?
I think it should be fine. They just talk.
Yeah, to be fair,
We
the
can just
person's
talk.
right here. I don't think we need that.
I guess they'll be able to.
Sorry, I was
hear
gonna
you.
give you a mic, but we don't need it. Okay. Never mind. So, yeah. So you guys are gonna be the friend who lost the cat. I'm going to be the person back from now. Yeah. How should we, they're in a pair though.
So you guys can, maybe one of you start. If
Yeah.
one of you is struggling, you can.
Yeah, so you can just start, be like, hi, like, how was your trip? To start it. Just ask her.
I'm still slightly confused. Did we lose the cat?
Yeah, you
So
both
you
lost the
You
cat.
were looking
lost
after
the
the cat. It ran away.
So we were looking after the cat. We lost it.
Yeah.
Yeah. So, and she's just come back from her trip and
You guys
she's,
want to discuss, or do you just want to start?
I think about it.
He was born ready. Okay.
So, how's your holiday?
It's good, thanks. Really enjoyed it. Where's Scruffy, by the way?
It's scruffy. Oh, the thing is, we
You what, sorry?
the cat. I feel so bad. I have a cat myself, but we let it out one day.
Sorry. I don't understand. So Scruffy's not here? Where is he?
Too sure he could be around the area. We've tried looking for him. We put posters up,
Right.
but he just went out one day.
That's so irresponsible. I left him with you and you've just lost him like that. I don't know what to say.
I know it's wrong, but I will make sure to find the cat. I'll ask around the neighborhood.
Okay, well, I feel really let down, but you're saying you've put posters up. What else have you done?
You communicate with the whole neighborhood.
Yeah.
And
And you have no signs so far.
you just put up the other day, so.
Okay,
in case
well, please keep at that for me and keep me posted.
you post.
Thank you.
well done.
Yeah.
Yeah, it's not realistic, but this is the kind of stuff you get given, honestly, like.
Yeah.
Guys,
How did you guys, wait, come back.
how did you think you did? So it's good to always reflect.
Reflection.
I think it was a bit more, but
I think you said the right things, you know, you said you were showing that you were being proactive, that you'd done stuff to try and get the cat back. But I think in terms of apologizing, you might want to try and use some keywords, just like, you know, I'm so sorry, I take full responsibility for this. I know you left. Anything else?
So just another thing, I think you said like we'll make sure to find it. It's kind of like that might not be possible to find it. So then it's like a good thing to say, yeah, we'll try our best to find it. But apart from that, I think you guys did quite well, and you showed the person that you were quite sorry, and it's good. Yeah, thanks for volunteering.
Oh,
do you want
oh, someone's okay. So on the chat, someone said you would need to be frank but also compassionate, and go at the friend's pace, and let her know that you have some news, tell her what's happened, let her process the information and ask any questions, and apologize, say that you're there for her, and be honest and supportive. I agree with that. That's a good point. I think we should. So we're going to do a kind of model answer. Obviously, there is no such thing as a model answer here, but we'll give it a go. So, yeah. Yeah, it was great, thanks. I really enjoyed it. Where's Scruffy, by the way?
About Scruffy, I have some bad news.
Oh,
Would you like to take a seat first?
pretend I'm sitting down now.
Yeah, I was looking after your cat and everything was going well, but one day I came downstairs and I couldn't see Scruffy, and then I realized that I left the back door open and I think Scruffy ran away. I haven't been able to see him.
That's so careless of you. I left you to look after him and you've lost him.
I'm really, really sorry, and I know that you trusted me in taking care of Scruffy. I take full responsibility for this.
Okay, I don't know what to say. You know, what have you managed to do anything about it since it happened?
I put up missing posters around the whole neighborhood, and I asked people if they've seen Scruffy, and I went searching for him every day for hours. I'm very, very sorry, and I feel really bad about this. Is there anything I can do else to help?
Well, I guess you can just keep putting posters up, getting people to contact you, ask around, and please keep me posted on what's happening.
Yeah, of course. I'll keep you updated on any news, and I'll continue putting up posters and asking people. I'm really sorry once again.
Okay, so, I saw those little ones. That was good, Padma. Do you guys have any feedback for us or anything you thought was good? No, or not so good? No.
I think the thing we did like kind of differently just at the start was signposting that I have some bad news.
Yeah.
Because that prepares the person for what you're going to say, and saying things like, "Do you want to have a seat?" just as helpful as well. And you can also be like, "Do you want to offer them a glass of water," something like that. Because signposting, yeah, just meant to protect them. So. Yeah,
rather than dropping a bombshell of, yeah, your cat's gone, by the way. Yeah.
We had like a different version of this question. I think St. George's.
Oh, St. George's, really?
Yeah, we said you killed the cat. Like, so you guys are giving things that you've done, like posted something.
Yeah.
They did ask you to break the news that you killed somebody. You can't bring the cat back to life. So how would you say by your holding or something?
You could, that's peak. You could talk about maybe replacing the cat, but obviously you have to show an awareness that these things aren't so easily replaced.
Yes, like you wouldn't want to replace it. You can't bring back the report.
No.
I think that's something you'd do, like not immediately. First you'd be like, "Oh, I'm really, really sorry it's happened," and then just after a long time, I don't know, maybe like a couple of weeks, you'd be like, replacement. But that's obviously something you wouldn't say in the role play. But after the role play is finished, you could say to the examiner, like after like some time, you might ask you for advice.
That's a bit more difficult to do, I would say, because the examiner tends to kind of just sit there like a lemon. They don't want you to talk to them usually, but then I'm thinking of in person. Online can be a bit, I don't know, it really depends, but
yeah, I know it depends on the type of interview, because if they have only the role play, then yeah, but then
if it's a panel,
if they want you to reflect afterwards as well, then you can bring it up like after some time.
Gemma?
Would you say like the new
Yeah, some kind of memorial thing, that wouldn't be too far off, but even though that sounds like a ridiculous example, I think I did actually get something like that at Cardiff. I think it was like one of the pets ate the other pet because you left it out of its cage. that was either at Cardiff or at my school, but I think it was Cardiff. So yeah, it can be a bit scary, but just if you work your way through those steps, the actor will respond to you. That's what I was trying to do here. Just kind of when the student is saying, you know, I've done this, the actor will hopefully be like, okay, you know, that's something you're putting effort in. Okay, you're apologizing to me. Okay, you know, rather than hopefully they won't just sit there and scream at you, but it really depends. Do the best with what you've got.
I feel like the main thing is just like not trying to go on the defensive side. Like don't be like, oh,
Yeah,
well, I've tried to do this and now nothing I can do. Like always try and emphasize that.
It's so important to take responsibility and to actually admit that you made a mistake. Some students go in there and they say, oh, you know, I don't know how this happened. Maybe someone else did something. But you have to take responsibility. Oh, another example, just if you ever want to practice in your own time, could be you were babysitting someone's kid and you took them to the corner shop to buy some sweets, and you looked away for a second and they ran across the road, and they like got into a car accident, but not a major one, just like, you know, they're a bit scraped up. But then you have to tell the parent what happened. I've had to do that one in the past. It's just something a bit different to, you know, pets and that sort of thing. So yeah. Let's have a check. Yeah, that's good. It's easy to get derailed with, oh, it says change it to, but it's not going to go to then, it's going to I don't know, but if you scroll down okay, yeah, moving on. Oh, sorry. Okay. Is that good? Do you want to go? Yeah.
So what have you done to find out more about dentistry? So this sort of question, we want to talk about work experience, or you can even talk about volunteering and how you've learned skills that will help you in dentistry. So this one question is asking directly about work experience, what do you think about this? So again, work experience is important to give a really personal answers and talk about things that stood out to you. And for like particular examples, volunteering, like if you volunteer in an elderly care home, for example, then you might be able to say things like residents with dementia and how you have to use the listening skills and communication to talk to them and build rapport with them. And you talk about different things you did, even if you worked with a practice manager, you talk about like how you learned organizational skills, all these types of things, and link it back to dentistry. And then you can also talk about any online courses or other reading that you've done. But yeah, the main thing is just make it quite personal.
Just out of curiosity, how many people here have actually done some dental work experience? Because I know COVID could have impacted things.
That's really
Good. That's really good. Does anyone have anything to share that they saw that was interesting during their work experience? Okay. Oh, yeah.
The news like really intense, and the patients like really sad.
Yeah, it's one of the perhaps negatives of the job, having to, you know, tell people those kinds of things. It can be difficult, and that's why it's important to have stress outlets as a dentist outside of your job, because that can take a toll on you as well. The lady behind. Oh, okay. Oh, oh, great. That's pretty good.
Okay, so next we're going to be talking about current issues. So dentistry is a field that's always evolving, and it's also a career that involves lifelong learning. So if you can show the interviewers that you're up to date with current issues, it'll show them that you are actually interested in dentistry, and it will also show them that you are someone that's aware that dentistry involves lifelong learning. So these are some of the issues. So the first one is COVID-19. So you can do some research into how COVID affected dentistry. So specific things you can look at is how it affected access to dental services. So it affected it quite a lot, and things are better now, but it will take time to recover. You can have a look at how oral health inequalities have been made worse by the fact that dentists were closed for a while, and it's now also quite hard to access a dentist. And one of the main things is about AGP, which are aerosol generating procedures. So the way, obviously in the past, you would have the face mask, but how things have changed, the different masks you need to wear. There's something called donning and doffing as well. So just research into that, and that'll be really good to show them that you like to stay up to date. You can have a look, if you search in Google, results will come up, but you can have a look on the GDC website, BDA, which is British Dental Association, and also something called SDCEP, so SDCEP. You can have a look on there.
Brilliant. And the next one is antibiotic resistance. This is something that became even more of an issue over COVID, actually, because while practices were closed for a while, dentists were prescribing more antibiotics to their patients because they weren't able to treat their dental infections with in-person appointments. So as you guys probably already know from your A-level biology and that sort of thing, the overprescribing of antibiotics can lead to bacteria mutating and becoming resistant, and this makes bacterial infections more and more difficult to treat. And it's led to so-called superbugs like MRSA developing, which are resistant to several types of antibiotic. And it's a growing problem within healthcare. So it's really important that dentists follow the guidelines for prescribing antibiotics so that they only give them to patients when they really need them. And we also have to stress to patients that they need to take their full course of antibiotics as well and not stop their tablets halfway, because that can actually increase the likelihood of resistance developing.
So then now we'll talk about NHS bands of treatment. So for dentistry, there are 3 bands. So the first one is the cheapest, then the second band, which is a bit more expensive, and third, which is the most expensive. And so the first one covers things like diagnosis and basic checkup and just giving advice to the patient. And then the second one includes things like having a tooth extraction or root canal treatment or fillings. And the third band includes things which involve the lab, so things like dentures or bridges. So it's good to just be aware of the bands and know that different treatments fall under different bands. And we have UDAs, which stand for Units of Dental Activity. And this is something that's recently been, there's been a change to this. So earlier, dentists used to be paid based off of how many treatments they performed. So if they did like 5 fillings, then they'll be paid for each of the fillings. But now they're paying for how many courses or treatments they do. So they would be paid the same if they do 1 filling or if they do 5 fillings, because they both fall under the same course of treatment. They're in the same, So this is just something that's good to be aware about again, because due to this, some dentists are like private dentists mainly. They want to get as many courses done as possible. So they might do things like take an extraction instead of a root canal treatment, because extractions take less time, so then that way they can fit in more treatments. So it's just kind of on the ethical kind of side of things as well. That's just something that's good to be aware about. And also this can cause stress for dentists as well, because they're trying to fit in more people and they have less time for things like giving advice to patients on preventive dentistry. Just how to have good oral hygiene in the first place, and that takes time as well to explain to the patients. And if they're focusing on doing as many treatments as possible, then of course they have less time for that. It's good to just be aware about it.
So something else you can also look into is the sugar tax, which was introduced in 2016, I believe. And this was created to address the rising levels of obesity and also the nation's poor health. So in your dental interview, you want to look at the impact it has on dentistry. You want to see whether it has been beneficial. You can look at some advantages, disadvantages, also how the public have responded to it. So you can look on BDJ, which is British Dental Journal. You can also have a look on dentistry.co.uk as well, but there'll be other sources. You might find a lot of it linked to medicine, but there will be some that link it to dentistry. And also in line with that, also know about how sugar and tooth decay are linked as well.
Okay, and the last one is preventive dentistry. And prevention is always better than cure. Dentists try to promote good oral hygiene practices to their patients. So obviously, brushing twice a day with fluoride toothpaste and flossing and that sort of thing, so that they can prevent both dental caries, which is cavities, and also gum disease. So that's how dentists push preventive dentistry in their practices. It can also be promoted through wider initiatives. Things like sugar tax actually are a good example. And also there's something called Child Smile, which is a national programme to improve the oral health of children in Scotland. So you can have a look at that if you like. And these kinds of things save the NHS money in the long run, because there's less patients with caries and gum disease to treat. And of course, also it just gives you a healthier, happier population.
Okay, so next I'll just be going through some general tips that you can remember for all of your interviews. So make sure to make your responses personal, especially the why dentistry one. They want to know that you've really considered the options and you don't want to just be repeating a generic thing. You don't want to have just memorized something. They want to know that you truly want to be a dentist. Also, you can take time to pause during your interview. They know that people are nervous. They know that it's stressful. So don't feel like you have to answer really quickly. You can take some time to think. You can even tell them, can I just have a second to think? Don't be afraid to correct yourself midway if you think you've made a mistake. It's better to get the right answer in the end than like kind of make yourself look better. So if you've made a mistake, just tell them, oh, actually, I think it's this answer. Know your personal statement very well. Barts and also a lot of the other dental schools will actually have a copy of your personal statement. So sometimes you forget, but of course, just try and remember, because they will ask you questions about this. For MMI and even for panel, if they've asked you a question and it didn't go well, or if you've done a station and it didn't go well, especially for MMI, just try and forget about that and move on to the next station. Even if you don't do well in one station, if you do well in the other ones, it'll be completely fine. For ethics, obviously we went through the GDC Principles and we went through the 4 pillars of medical ethics. So try and keep those in mind if you get role plays about like ethical dilemmas. And also, because the 4 pillars of medical ethics, they're linked to medicine and dentistry, but just to make it more relevant to dentistry, try and link it to the GDC Principles. Remember the STAR method. So just have it in your mind. You don't actually have to be like, oh, situation this, task this. Dress smartly, have good posture, and remember with communication, it also involves body language. So eye contact with the interviewer, smiling, try and avoid slang and informal language. Like you don't have to completely change the way you speak, but just remember, you want to come across a bit professional. And be confident, don't be arrogant. Interviewers don't like that at all. And yeah, just be yourself, especially for Barts, I would say literally just be yourself. It's basically a conversation. I think everyone that's done Barts interview said it's really chill, it's really nice. You can just be yourself.
So here are just some resources that you can use to help you prepare. SAMDA, we have a YouTube channel as well, so if you go on there, you find like a whole range of resources. MedicMind and MedicPortal, good websites as well. You can find like some example questions there, and they have some quizzes if you're interested. And then the multiple mini interviews for you can underscore book is quite helpful as well, because it tells you like lots of different ranges of interview questions. You can try practicing, and for each university as well, they can give you some kind of like more guidance on how to prepare for that specific one. And then BDA, if you have a look on their website, you'll find lots of resources, and sometimes they have news articles as well. So if you want to keep up to date, then you can have a look there.
So probably the last interactive thing we've got. We're going to give you guys a chance to answer the question, why dentistry? And we can give you some feedback. It's a question that comes up in every interview, so it's a good chance to practice it if you want to give it a go. Anyone? Yes, you can say a few points as well. Yeah, if you don't want to give like a whole fully fledged answer, just maybe 1 or 2 points. You can shout them out. Yeah.
Fascinatingly, I was considering medicine at first as well, but then I didn't realize that dentistry was sort of a profession I wanted to go into. Because there's a reason that like you're able to build rapport with your patients over time, if you're like a family therapist. Whereas like if you were like in medicine, you don't really get that chance because you see so many different patients every single day. But with dentistry, you kind of see the same patients over and over again.
That's a good one. Okay.
It's really nice part of dentistry, definitely.
Someone's asked if there's a recommended duration of the response answer. So if you've got 5-minute MMI stations or something like that, you would probably want to talk for as much of the 5 minutes as you can if you've just been given one question and it's not like back and forth. But in a panel, it's good. I'd say in terms of structure, it's good to have 3 points and use the STAR method if you're going through like a situation that happened or an example or something.
The only thing I would say is sometimes you don't know if they have more questions for MMIs, so don't like talk for the whole 5 minutes because the interviewer might have follow-up questions that they want to ask, so kind of like leave some time for that. Or if you just take like a pause after you're finished talking, and then if they ask you, if you don't have any question, there'll probably be like anything else, and you can just continue. But if they do have follow-up questions, then it's going to leave some time.
I would also say just because an answer is really long doesn't mean it's good. So if you've answered and it's short, but you're confident like that's your answer, that's fine. Like don't feel like you have to keep on talking and talking. Like just be confident with your answer. I think that will be fine.
Another thing as well with MMIs, you might have spoken for maybe 2 or 3 minutes and stopped and felt like, okay, that's an answer. And then you might think of another point while you've still got a minute left on the clock. Don't be afraid to go, oh, I've got something to add. Because you might as well if you thought of another point that's worth saying.
And also I'd say maybe more with panel, especially like Barts, that's just a conversation, try and like gauge the interviewer's response. Like you don't want to be talking for ages and ages and they're sitting there like, so try and like observe. Also you'll be maintaining eye contact with them, which is good. So kind of try and just get cues from their body language and stuff like that.
Another thing though is that sometimes they will try and throw you off. I've heard of King's interviewers like pretending they're asleep before. And even during my King's interview, you know, they'll act very disinterested, but you have to stick with what you're saying and show that you've got conviction in what you're saying. Otherwise, you'll just get thrown off and you won't get to give those answers that you've been preparing and show how enthusiastic you are.
Yeah, that's true. I think it's important, yeah, definitely just stay confident, say what you plan to say. And then, but sometimes interviewers do try and help you as well. Like for King's, I remember they tried to help, like in one of the stations, if it's an MMI, they might try and lead you in the right direction for things like ethical situations, especially if you're thinking about maybe like one like part, and then if they have something else in mind, they might try to like lead you towards it. So make sure you like listen to them and like pick up on what they're saying, because it can be helpful.
So that is the end of our presentation. We just have a couple of slides left, but if there's any questions, then please feel free to ask. And anyone on Zoom, there's a Menti code there. So if you just go on, is it menti.com?
Yeah.
Yeah.
You guys can go on Menti as well if you don't
want
to speak.
Yeah.
It's all anonymous, so feel free.
Yeah.
For the white dentistry question, can you almost repeat what you were saying?
I think you can, but also build on it a bit. Like don't do it word for word, especially if they've got a copy. It won't seem like that genuine. But obviously that is why you wanted to do dentistry. You wrote it there. You can say it again. Just try and build on it a bit more. Don't just do it like word for word.
Yeah, but for MMIs, the interviewers, they won't have a copy generally, so then you can just use the points from there. But yeah, as Naomi said, just build on it.
About like how to teach
Mm.
like what
Yeah,
would you
yeah.
do about like apples, what's your favorite?
That's, yeah, like if you go on the website for the unis, they'll sometimes have like a breakdown of what we do in each year of the course. So I think for Barts, it's quite nice how they have early patient contact, like in second year, and then outreach clinics later on, like third and fourth years. Yeah, that's quite a nice aspect because some unis you have to wait until like third year for patient contact. So that's quite a nice thing about Barts, I think.
Yeah, I think also, obviously because of COVID, a lot of things have changed, but you would have lectures, so that's like with everyone, but you'd also have like small group teaching. They might give you a lecture and you can read it yourself, and then you get the chance to have the tutorial or the small group and you can ask questions about it. So I think there's specific names for like the type of teaching.
Like, I think sometimes they have like PBLs, like which a lot of unis they focus a lot on that. So if that's something that you think is good for you, you like learning that way, then you can mention it in the interview. And I think Manchester, they also have a type of thing like PBL, but they call it something else. So just go on the university website and then you should have them further out.
Another really good thing to do is to speak. I mean, you've got us for Barts, but like at other unis, you can speak to those students and ask them as well and get personalized answers, because that will make it sound a lot more convincing. You can say, you know, I went to this open day, already shows that you're interested. And I spoke to a student and they said this, this and this, and it sounded really good. You could even, I don't know if I'm allowed to say this because of safeguarding, but if you know any like, I don't know, big Instagram accounts or YouTubers, you could maybe just DM them with a couple of questions. People are always happy to help in dentistry, to be honest. So if you said, you know, what do you like about your uni, or just any questions, they would be willing to help out potentially.
Yeah. And just to clarify, Barts, medics do PBLs, dentists don't do PBLs, but we do similar, like the small group stuff.
We're not really, our PBLs are not the same as medic ones, they're very different. But yeah, I haven't received anything.
What did you guys do to train manual dexterity?
So I learned how to crochet and I just brought it in and showed the interviewers. And they're like, oh, that's really cool. And one of the interviewers have been trying to learn how to crochet as well. So, I was like, yeah. So just bring it in, just bring anything in.
Even if it's like a big musical instrument, like for example, like guitars and things. I think that's too much.
I think because I don't, if it's online, I feel like that could be fine. Just play them a little, you know. But if it's in person, because you do it in like a hall, so you don't want to start playing and like disrupt the other people. But if it's online, I reckon you could do it. If you've done like grades and stuff, you can just say I'm grade this, or I play guitar, I've performed here, blah blah blah. Yeah. But if it's something you can bring in, do try and bring it in. They really like it. But I said crocheting I brought in. I also like bake and stuff. I didn't bring that in, but one of the interviewers was like, oh, should have brought something in. So yeah.
Yeah, you can do that. Like even like henna designs or like mehndi designs, if you like do that, if you know how to do that, then that's also an example. You can just like bring in a picture or something.
Okay, I'm going to run through some of the, oh, sorry, did I cut you off?
Are you sure?
Okay. I'm going to run through some of the mentee questions. Someone asked, did you all get offers from King's as well as Barts? I had an interview at King's, as I mentioned. I was on their waiting list, but I didn't get in. It was my first interview and they were very scary. I can't lie, like King's, you go there, some of the MMI interviewers, it feels like they're interrogating you. It's like good cop, bad cop. And then there's no tour around the dental school afterwards or anything like that, you just go. So yeah, I didn't enjoy my experience personally at the King's interview, but yeah, did you guys do King's interview?
I got an offer from King's as well, but then Barts just disliked it. Yeah.
I didn't apply to King's. My dentist went there and he was like, don't go there.
So, yeah, a common thing we all say is, you know, Barts just seems to be a lot more friendly than King's, maybe because it's a tighter knit dental school, but yeah, King's is good too, obviously. So how would online MMIs work? You have often it's Zoom breakout rooms or Teams, depending on the uni. Anything? I don't think there's much else to say about that. I'm trying to think back to when I was helping it last year. Yeah, that's pretty much it.
They may send things in advance for you to prepare, because obviously they can't just give it to you on the day.
Like an article. That's
Yeah.
what they did for Barts last year. They may do that this year again. Normally, Barts in person did a video that you would watch and then you'd have to talk about in your panel interview, and it would just be an example of kind of bad communication between a dentist and a nurse usually. But the article is a bit more, it's hard to practice, but if you read around dentistry, then it can help you prepare for that sort of thing. Will we have access to the Zoom recording? Matthew, do you know? Someone asked if they'll have access to the Zoom recording. You will, yeah. I did actually start it a few slides in, so it's a bit late, but most of it's recorded. Are you allowed to joke slightly, or is that too informal? You can,
yeah.
and it shows personality, if anything.
Yeah, I think especially for panel ones, because then you have like a lot of time to talk to the same people. So yeah, get your points across, and then like you can joke. Yeah,
It's good to be lighthearted.
Yeah, I'd also say you can kind of see the kind of interview you have as well. And if you're joking, make sure it's not like inappropriate stuff. You know?
How can we start slowly preparing if we still haven't heard back? How long should we be spending preparing to the lead up to interviews?
I think it's like once you start doing the interviews, then you kind of like you can see how the first one goes, and it helps to prepare for the second one, third one. But I would say generally like, I don't know, a few weeks.
A few weeks, yeah. But
As in they don't know whether they've received
oh, if you
an
don't know,
invite to interview or something.
oh, if you still haven't heard back yet. Well, the earliest interview I had was December 12th, and that was King's. They do their first batch of interviews in December, so I've never heard of anyone being earlier than December. Obviously, December's not that far, but if someone were to have a King's interview for that time, I think they would have heard by now, probably. You would normally get like a few weeks notice minimum.
Yeah, I think you would always have a bit of notice.
But if you haven't heard back from anywhere yet, it doesn't hurt to start preparing for interviews already, you know, because you never know. And in terms of how to prepare, personally, what I did was, I remember I didn't prepare enough for my King's one. So then the ones after that, I made sure to kind of practice with friends, with family, use any contacts that you have, but also practice on your own. And I made a table of different questions and my bullet point answers. I would say don't write out a script because you're going to sound very, very scripted, and don't overly practice to the point where you then end up coming up with a script in your head anyway. But bullet points are very helpful.
Definitely, I think just practicing your answers. But I think it's good that if you practice saying it out loud, then it really helps, because if you have the ideas in your head, then that's obviously really good. But then when you actually have to say it out loud, you can kind of get nervous on the day. But if you've already practiced it like a few times, then it's really helpful.
I did like mock interviews with my friends, and then some of my teachers didn't mind doing it. So with your friends, it's kind of more chill and you might end up joking around, but with the teacher, it's kind of more like the actual interview. So I did that. The blue MMI book was like really helpful. So I used that a lot. Yeah. And the university websites, I just make sure you know the key information about the universities.
Yeah, definitely practicing with friends is really good as well, because you can learn from each other, help each other.
Yeah, for sure. And if you have, you know, any family members or anyone you know who's a doctor or any kind of professional background really, then they will have interview techniques that they can give you and advice. A person doesn't have to be from a medical background to give you tips on your interview skills. Someone has said, did they expect you to have done any more work experience after your personal statement? Not necessarily, but if you have, then it's good to mention. When a Barts interview offers some, oh, sorry. Yeah. Depends on the uni. Barts possibly a bit less so, but some unis will expect you to know the difference between different types of filling materials and have a rough idea of certain technical things.
Yeah, I feel like Manchester, I remember when I went there, they had so many stations. Like usually I would expect like 5, 6. They had like 10 or something. It's quite a lot. But yeah, they were quite specific. They're more specific. So they asked about like, yeah, just filling materials and like, I don't know why amalgam is being updated, things like that. Just general topics like that.
Yeah.
Yeah.
And that sort of question to the other council.
Well,
Sometimes you can
Guess.
honestly you can guess, but sometimes, yeah, sometimes I feel like you can honestly just say you don't know. Like if you don't know,
but
don't
if
try
you,
and
like, know
make something.
something about the topic, like even if it's not necessarily directly related to the question, but if it's like still about the same topic, then you can show that you have some knowledge about that topic. And then if you say something, then as I said, they may help to then the examiner realize, or at least they know something, they may help you guide you in the right direction. Like from based off what you've said. Then you might get ideas based off what the examiner is saying. But if you just like don't say anything at all, then it'll be a bit harder.
Yep.
You mentioned that you don't get people, so if you want to expect someone to say
Sorry, could you repeat that, please?
how you talk to people.
How are we taught if not PBLs?
Like here. So it's
Mixture.
yeah, it's a mix. So we have lectures, which is just everyone. When I was in first year, it was in person, like it was in here. I think they may be sticking to online. So it's online lectures with everyone. You have a clinical group. So you may have teaching with them, just them and the tutor sometimes. So it's like group teaching and then whole year teaching. And also like mixed, like online, in person.
So those are group seminars, like Naomi mentioned, you'll probably have 2 clinical groups together on the online platform with the tutor. Sometimes you have presentations to do, sometimes group work, sometimes individual ones. And that's where they call it a PBL. It's not a proper PBL, to be honest, but for our dental materials module, they really like PBLs. So they basically get you to do a group presentation, and then you have to do like a WIHSOC report where you just regurgitate the same information to Word. Anyway, you obviously also spend your time on clinics, and that's with your clinical group always. So to be honest, by the time you get to 3rd year, you pretty much only see your clinical group, especially because we're having online lectures. We don't get to come in and see the whole year group together, which I kind of miss. But yeah, so on clinics, you'll be with the same group. And it's nice because you can build a rapport with your group through the 5 years.
Yeah, so you can say that you like small group teaching, if that's something that you like, because that's what Barts does a lot of.
There's more.
Can I also say quickly, I think someone said something about amalgam. We didn't really put that in the current issues because it's kind of being phased out. I think they could.
That's something worth knowing.
Yeah, you could look into that a bit, like what is amalgam, so it's a filling material, and also why is it being phased out. So by the time you guys are in practice, it's probably not going to be used, but we still use it on clinics when we're practicing and stuff. So just be aware of that as well.
Someone's asked if acrylic nails is an example you could use in manual dexterity. It definitely is.
Yeah.
Oh, did you? Yeah, it's a good example. The only thing is you can't actually have your nails done in clinic, which is a bit sad. But yeah, it's a good one. And also baking, someone's mentioned, especially if you're doing things with icing and that's almost like drawing, then that would be a really good one. And what dental universities use MMO and which ones use panels? You can see that on their websites. There's way too many for me to go through.
I think most do MMO.
Barts,
Sheffield, Barts and Sheffield are
Is
panel.
Plymouth MMI now? I think they changed. Yeah. But yeah, most up-to-date information will be on the websites. Yeah.
What if you get the first year and you mention your backup? Just say that I will consider the backup.
Or if they
Yeah.
ask you if you don't, then what will you do? I mean, you can, but I think it also like maybe depends on what it is. Like if it's something that I mean, what your long-term plan is, do you plan to do the backup course and then I don't know, maybe like apply for graduate entry or something? I don't know, like it depends on what you're thinking of. But if it's something that's completely different to dentistry, then maybe don't mention it, because then they'll be like, because they want to see like how much your commitment to dentistry. So yeah, I think it just depends.
Do dental schools like seeing a lot of enrichment activities, or is a few okay as long as you can explain them well? A few is fine, as long as you can explain them. You don't have to have like a really long list. It's quality over
Yeah.
quantity. It's rather than listing what you've done in your interview answers, it's important that you show what you've gained from those experiences and how that then translates to dentistry and the transferable skills. I think that's mostly it here. And to answer the people on Menti, yes, you can have a scrapbook and henna as manual dexterity examples. Are there any other questions?
You guys can ask questions like just about Barts or just about being a dental student or anything really. It doesn't have to be interview specific.
So I applied to Barts, Kings, Manchester and Birmingham. So I just applied to these because, I mean, I live in London and Barts and Kings also are in London. Then Manchester and Birmingham are, I guess, like closest to London because the other ones are like quite far. And plus, yeah, that's to be honest, like one of the main reasons. And I went to the open days for these unis as well. And well, I didn't go to Manchester, but I went to the other three. And I did like it there. I liked the vibe, and Barts was really, really friendly. So I think in the end, yeah, it just came out because Barts had such a nice atmosphere. And I talked to some of the students already studying here on the open day, and they were like, yeah, it's just really nice and it's close to home. And, yeah, I like the early patient contact as well. So I was like, yes, it's something.
Similar to Cladna, I applied to King's, Barts, Cardiff and Birmingham. And I'm also a Londoner, so the first two were no-brainer. And then Cardiff, well, for me personally, my brother did dentistry at Cardiff, so I felt like it would make sense. And he said that Cardiff was a good uni, so yeah, I looked into it and I liked it. Same with Birmingham. Birmingham's a really good dental school. But for me personally, I didn't get a chance to attend their open days, so I based my choice on, well, which offers I received, but also my experience on interview day and how I felt like, you know, how the uni treated us kind of. So like Birmingham and Barts were the two that stood out to me as being very friendly and, you know, ask us anything, we're here to help you. And those were the two that I actually ended up getting offers from anyway. So yeah, and then Barts was in London, so I picked it.
So I applied to Barts, Manchester, Birmingham and Sheffield. So I went to the Barts open day and I really liked it. King's, obviously I didn't apply because what my dentist told me. I didn't go to the other three for open days. So like Zaina, I just used the interview days to decide. Sheffield, I didn't really like the vibe and stuff. So I was stuck between Manchester and Barts. So I think literally everyone says it, like Barts is such a lovely place. Like the sense of community is really strong. The older years are really friendly. Like even with the medics, like everyone is so friendly. So I think that's why I really went with Barts. I'm also from Essex as well, so distance to London is a bit better for me. But yeah, there's a lot of things that I liked about Barts. Early patient contact, they do like a mummies and daddies thing, societies, like it's just a really great uni in general. And the fact that obviously it's part of QM as well, but like Barts, I feel like we have our own kind of like culture and community. So I really like that. So that's why I went with Barts. Merger Cup, is that that?
Or BDSA Sports Day.
Oh, yeah.
They've stopped doing that.
BDSA Sports Day.
They've stopped doing that because it gets rowdy. I remember, but there's a BDSA conference every year, which is a really big event that a lot of dental students go to. There's a ball, there's like lectures, there's nights out, that sort of thing. So if you're into that, then yeah. There's lots of different conferences actually, like different companies will do big student conferences. So that's quite a fun thing. Dentistry is very social. Like we have Barts Dental Society who have a dental dinner every year, and I just organised the midway ball for my year group, which was delayed from last year because of COVID, and your year is going to be having that soon. Like we like to celebrate our milestones, we like to kind of come together at the end of the year and go, you know, that was a tough year, we've gotten through it together. So that's a big plus about Barts, I would say.
What sort of society?
Sorry?
What sort of societies?
I'm personally in Women in Healthcare as a dental rep. So we're part of the outreach team, which is helping people like you guys get into uni and similar stuff. And I'm part of Islamic Society as a marketing rep. and I was year rep last year on DentSoc. You guys?
So Women in Healthcare, I'm a dental rep, African Caribbean Society, I'm president, Christian Union, I'm secretary, lacrosse, basketball. Yeah.
So I'm in SAMDA, and I'm a second year dental student, so probably I'll apply for more later on as well, but I'm in SAMDA and I joined badminton, so that's like a weekly thing, I just go there.
And I would say
Then Saturdays and Saturdays.
with societies, I feel like definitely join societies. That's where I made a lot of friends. Like a lot of my close friends I met from like sports club and stuff like that. You get a chance to go to taster sessions during Freshers Week, so you can just go to loads. I feel like I did quite a lot. Sometimes it's good to just do a few and stick with that, but I would say definitely go to that. There's a Barts societies, which like only Barts can join, but Queen Mary also have loads of societies as well. So that's a great chance to get to know like QM students as well. So.
And not only do we have access to their societies, but their whole campus, all of the facilities. So my own library is really big, so it's got lots of different floors. Our library here is great as well, but it's nice to be able to go and have like a change of scenery. There's lots of cool stuff on QM's campus, so that's another big plus. Any more? Oh, someone's asked, do students get to be involved in research? You do, but you have to kind of look for it. That's something that I'm trying to do at the moment, but there are different people doing different projects with tutors or outside of uni. You have to kind of be a bit proactive about it, and you can, the staff is so helpful here. If you want to try and do something, then you can speak to someone and they'll point you in the right direction.
Also in third year, you do a SSC, which is called
Student selected
component. So they give you a list of topics you can pick from, but if there's something that you're actually passionate about, there's an option for you to choose your own thing. So you get assigned a tutor, and if it's really good, you can actually get published. I think some people in the year above got published, so there's opportunity to do that as well. You had a question. So I moved out. I didn't stay in like the uni accommodation, I stayed in a private one. But I think because of where I live, moving out was more convenient for me. I think I stayed private, but sometimes I kind of regret that and wish I stayed in the like uni accommodation, because for Barts, you're just with Barts people, so I guess you can relate, like most people are medics and dentists, and I feel like that's the easy way to make friends. But I think if you commute, like you can easily make friends as well.
There's even a commuters society,
Yeah.
I think. I commuted for the first half of first year, and that was from South London, so near Croydon. And I personally found it a bit draining, to be honest. I mean, it depends on how long your commute is, but you know, when there's lots of like delays and cancellations and stuff, it's a pain. So I moved out halfway through first year, not into halls either, into private. And I'm still living out now until I graduate. Living out is really good because it means that you can, you know, you kind of can organize your own time and have control of your schedule and easily access all of the uni facilities, rather than kind of having to trek into uni, especially when you get to like third, fourth, fifth year and you're on clinics more often, you're going to outreach clinics as well. It just makes travel easier and gives you more time in the day that you're not spending sitting on a train. But it's not an absolute must. I know lots of people who commute and they're happy to commute. So you have to kind of weigh up what works for you. What about you?
So I stayed at home for first year, and everything was online first year anyway. But the people who lived out first year, like I think it was quite nice for them because to get to know everyone. Since everything is online, it's like we don't really see each other like for lectures and things like that. So I guess it's nice to like live out first year, but I stayed at home first year, but second year this year I moved out. So I just, yeah, it's nice because as you said, like manage your own time, and it's just I personally feel like if it's an event at uni, I'll be like, yeah, let me just like go to it. Whereas if I was at home, I'll be like, oh, like, I have to go into uni for this event. So I guess it depends on you, but I think I just moved out with the experience. Like 1 year, I just wanted to try it and see how it was. It's really good so far.
Yeah, I would also say with societies, I think if you're living out, sometimes it's a bit easier for you to go to the events or like sports clubs. I know quite a few people that live out and they just find it a bit, people that live at home, they just find it a bit harder because after uni, it's like, do I go home and then come back? So I think it's a bit easier to attend events and stuff if you live out, but obviously living at home is also convenient. Like sometimes it's long to come back from like lectures all day and then you have to like clean and like cook and stuff. And also like money wise, you can save a lot of money living at home. So there's pros and cons, so just weigh it out. Like if you're not someone that really cares about societies and stuff and like going to loads of events, then living at home might be fine for you.
I would say even if you're a bit more of a homebody, it's really good to try and get involved just to kind of build connections with people who you can then ask for help if you need to. And to just, you know, make a few friends. It's quite important. But I'm getting the question a lot of when can you expect to receive interview offers for Barts, King's, different unis. Depends on the uni, because like I said, King's have a batch of interviews in December, but they also do January and I think February as well. So they release their interviews at different times. Barts do their interviews usually late January, I want to say. For me personally, Birmingham and Cardiff were both in February. So it's kind of anywhere between December and February. If you speak to the uni's admissions team, they'll tell you roughly when, hopefully. So it's best to get in touch with them really. And someone also asked about something to do with UCAS tariff points. Again, admissions teams are the best people to speak to on these things because we're not too clear on that.
I think UCAS tariff is for Barts, they look at that. But for dentistry, I think it's fine. Like, if you have 3 A levels and like you just, I think that's fine. For medicine, it's more like they want to have a higher UCAS tariff point to get in. But for dentistry, I think it's okay. If you have like 3 A levels, yeah, I think it's fine. And also just about hearing back from interviews. Like if you have people in your school or your friends that heard back already and you haven't, like, don't just like be like, oh, okay, I'm not gonna get one, because they can take some time and sometimes they have it in batches and we do interviews in batches, so you might just hear back a bit later. So just focus on like, what you're doing, focus on your work, and yeah, you should hear back. And if not, then it's okay. Just focus on the ones that you do hear back from, and
absolutely.
Just
It's really important to stay optimistic because this whole process of the application and interviews is very emotionally taxing, especially if you've got, you know, other things going on outside of it and just balancing with studying for your A levels. It's a lot. But if you take things day by day and kind of try not to worry too much about the future, just focus on the information that you have and doing the best of what you have, then that's the best way to get through it. Someone's asked what the downsides of QM are.
I would say for me, I really like Barts, like the campus and everything, but the area was a big thing for me. I didn't really like it. Compared to, I guess we don't have like a proper campus, but we can go onto QM campus, which is really nice. And I guess compared to other areas in London, like Whitechapel isn't the nicest. So that was the downside for me. And then maybe also, I think it's nice that we just have like Barts, like our own community as well. But I feel like for accommodation and other stuff, I would have liked to have been able to just be with everyone in QM as well. But like we said, we're able to join QM societies. So like you are actually able to meet a lot of people from Queen Mary if you actually make the effort. Yeah.
One thing I would say about location is Whitechapel's not the prettiest place on the planet. And when I first came here on an open day, I think, I was a bit surprised, but honestly, I've come to love it here. Like I've been living out the last few years and it's so convenient. You can get to Central so quickly, you can get to all the outreach clinics, and it's actually cheaper to be here rather than a Union Zone 1. So it really does have its benefits at the same time. And there's also an insane amount of food options. So that's a plus, and halal food if anyone has got that. But another potentially downside, COVID has really had an impact on how much clinical experience we've had. hopefully by the time you guys get to uni, that won't be such an issue, but it's meant that we all do feel quite behind, especially those of us in the upper years like me in 4th year. But the uni are doing their best to catch us up. And the thing is, they are being held responsible by the GDC because there are certain requirements that we have to achieve before we can graduate. So it's not like the uni is just vibing their way through it, like they do have to follow certain rules. So it's kind of comforting knowing that that's in place, I guess, even though at the moment we've got catching up to do. We know that it will be done before we graduate. But it is something, you know, in the process, just feeling like, oh, I'm a 4th year and I haven't even done a filling on a patient yet, which is not how it normally would be. But COVID has really changed things, especially in London. The rates got so bad that, you know, the number of patients that were able to come in, we had to shut things down for a while. So that is another thing to think about. In other unis, they have seen more patients at the same stage. But again, hopefully by the time you guys get in, it won't be such a big thing. But at the moment, like my friend in Bristol, for example, she's in 4th year, she's done a lot more than I have. So yeah, just something to think about. I think that's it. If there's any other questions, we'll take them. Otherwise, I think we can wrap up. Oh, sorry. Yep.
So, yeah. We would just appreciate your feedback for the event. So if you can just scan the QR code and just complete an anonymous form, that would be really appreciated. And after that, you'll be able to access your certificate of attendance, the SAMDA application guide, and mailing list for future events.
Just give people a moment.
Are you able to move that?
Oh yeah.
Just